Hi everyone, I am Becky, CEO and founder of Holistic Reflection, CIC, non-profit organisation. Today I want to talk about early signs of laminitis and how you might recognise it in a horse with a foot of this shape and a particular type of metabolism. I have no idea what it's called or how you might identify it. All I can do is tell you that this horse is very prone to stress-induced laminitis, and that stress can come about from pain from a small, fairly insignificant injury. She's 19, as I said, and we've adopted her since she came from the race track, as a 3-year-old. And she was diagnosed at 5, a very fit, healthy, young ridden horse with pedal osteitis, which is bony changes to the pedal bone, and this can come about through chronic laminitis. At the time, the vets, the farrier or myself didn't recognise it as chronic founder. I since know that it is chronic founder, and we have had to carefully manage this horse to sort of prevent the onset of acute laminitis. So we've never actually had a significant acute episode of laminitis, but we have had bouts where she's had distal or a downward displacement of the internal foot within the hoof capsule. And the triggers for that can be dietary changes, stress, wormers, vaccinations, chemical sedation. So we cannot vaccinate or sedate this horse, and thankfully we've not had to worm her for several years because of the careful dietary management that we have with this horse. So Sun had an accident 4 or 5 days ago. We're not quite sure exactly when, but on Tuesday we found underneath some mud on her legs a couple of really insignificant scrapes where the hair had been scraped off her leg. She wasn't unsound, she looked fine, she didn't look stressed. Knowing what we know about this horse, we actually gave her Danilon, which is the protocol that we have with our vet, because we understand the patterns which often follow. So she had 2 days of Danilon. We thought we were out of the woods, and then this morning she had none, and this evening we brought her out of the field and found that she does actually now have raised pulses. Not the field, sorry, the turnout, because this isn't a grass-kept horse. And I want to show you what that looks like and how you might assess that. So here I can see that she's just passed a few droplets of liquid, not feces, just liquid, which is another sign of things not quite right. So the stress impacts the microbiome of the horse. As you can see, this horse has quite a large pendulous abdomen. Equibiome tests have shown about 5 months ago that there are bacteria populations that would create inflammation within the gut, and that has an impact on the whole horse. So the stress in this instance, because there's been no other environmental changes, she's not in season, because her seasons actually create inflammation and sometimes mild laminitis. So there's been no changes other than the accident. So I'll just show you now what we found. I don't know if you can see, but there's a little bit of hair loss just in the front lateral fetlock joint there. Little tiny piece of hair loss in the coronet band just there, and if we go around the other side you'll see a similar piece of hair loss, perhaps, maybe you can't because of the sun, just here. So we think she might have rolled in the menage where she spends most of her time loafing and got her back legs trapped between the horizontal wooden the horizontal wooden posts there. So we have raised digital pulses in this horse, which can be felt here in what's called the Van apparatus, the vein artery nerve, on either side, the lateral or the medial side of the horse. And there's that irritated gut. So she has what I would consider a 1 out of 3. But what I noticed as she came in straight away was this change just here. Look, can you see how it sort of dips down and in, and there's a dip here? It's actually worse on the other leg. She's just standing on the edge of this wooden board here, but I hope you can see that just here there's a dip and then it kind of bulges out. Not so hard, not so easy to see. See if I can see it from this angle. And what I do as a podiatrist, equine podiatrist and as horse owner, is I can palpate around the coronet band, and can you see how it sort of dips down and then it rises up, and then you can see that the hoof capsule at the top is very soft and almost puffy and swollen, and it goes all the way around and follows the pattern all the way around. She's happy, freely walking forward. She's not lame with a capital L, and it is harder to spot lameness when it is bilateral, but the main thing to notice is there is no heat at all in this hoof capsule, which indicates that there might not be the start of laminitis in the actual lamella. So I just wanted to show you the palpation on this foot too, and again I can slide my hand down and then we almost hit a shelf just here and it runs off. But not only that, but I can feel that and I can see that the lateral cartilages are kind of lower down. The whole foot, internal foot, is lower down within the hoof capsule. And I wanted to show you the underside of the foot. It's a hard sole. I've just cleaned it up so you can see everything. It's not a particularly healthy foot. After years and years of mild laminitis and chronic inflammatory conditions, this is not a healthy foot anymore. However, there are no signs of distal displacement or laminitis in this hoof capsule. So really what I want to say is, by the time you've got a very lame horse, heat in the hoof capsule and a very raised digital pulse and signs of pain, evident signs of pain in the horse, potentially even sort of a bulging sole, these sort of things, maybe signs of bruising or bleeding, you may have missed the opportunity to halt the progression of the disease into more serious laminitis. So early recognition of the disorder, symptom, disease, whatever you want to call it, is really important in preventing more serious consequences, longer term lameness and potentially death in these horses. So for this horse, on this occasion, with the agreement and treatment plan that we have with our vet and with our team, she will be contained in a smaller area, but she won't be stabled, which increases her stress levels. She will be in a small area with her friend, who she doesn't like to be separated from, and the rest of the herd will be right next door, so she'll feel like she's within the herd. So this horse is the herd leader. She does feel stressed and vulnerable when something goes amiss with her physical body, and that in itself can increase the stress and actually create more depletion and further loss of homeostasis, which can then trigger further laminitis. So we have to carefully manage this horse. She'll just remain on a simple hay, simple supplement diet. She's on probiotics already. We'll probably up the gut support by feeding additional herbs that support the lining of the gut. And we'll support the foot with Soulmate pads, 4-pound Soulmate pads. You might want to discuss, if you're dealing with a horse like this, with your team, your hoof carer, your vet, maybe even your body worker, how you might support your horse going forward. So this horse is actually scheduled for a McTimney chiropractor cranial sacral session with Rachel Hamer. So I shall discuss with Rachel what's actually going on now to see how appropriate it is for her to have a treatment next week or the week after next.